In light of the recent events in healthcare and the challenges arising from COVID-19, we've created an incident management lens board that you can use as a single source for all information needed to manage any incident. The board, like any other lens board, is accessible from any device and is customizable for your specific needs and processes, but this video will identify valuable components of an incident management system for a COVID-19 response. Starting on the Today page, you will see that we have critical information on the virus's impact that is readily viewable for all members of Incident Command. This real-time board allows the latest information to be shared on any web-enabled device, anytime. Fully customizable, the Today page includes essential information such as patients of interest, those patients in your facility who are suspected or confirmed positive for COVID-19. Keeping track of the Incident Command team and contact information promotes organized and timely decision-making and action. You can create tracking updates for staff who are out due to COVID-19 exposure or infection, as well as those units most impacted. Scrolling down, you see links to breaking news, testing site locations, and an embedded URL to the CDC or to your local emergency management agency. In addition, we have provided access to the real-time Johns Hopkins COVID-19 widget to display real-time disease impact. Like lens boards on the units, you can run your briefings right here. Once you start the meeting, you can take notes on the board in real time and make sure you are following the briefing huddle. You can include a link webinar and/or phone contact for others to join the briefing remotely while viewing the board from their devices. Frequently asked questions can have a prominent place on the Today page as an inventory of the messages and responses designed by your leadership team. This will become a useful resource while rounding, during town halls, answering emails, etc. This will provide consistent information and messaging from the leadership team, which will create a sense of calm for anxious staff, patients, and community. Next, we move to the Issues page. On this page, you can see the tabs running across the top of the screen. There is a tab dedicated to each role in the Incident Command team. These tabs are meant to be owned by the leaders in those various roles. If we move to the Public Information Officer tab, you can see, for example, there are various lists that would be specific for the PIO. Those lists may include daily key messages for external stakeholders, PSAs, requests from the media, and the like. The PIO can assign support roles to manage and report upon issues pertaining to that list near the time of each briefing. The point is that anyone with access to the Incident Command lens board can see this information real-time from any web-enabled device. On the Issues page, you also have the ability to accept text messages to the Incident Command board. While they would not have access to the board itself, they would have a voice and be able to send questions, concerns, and updates to the board. As we know, during Incident Command on an issue of this magnitude, the information coming into Incident Command is chaotic and overwhelming. Having a central repository of all concerns that are date and time stamped can limit emails, calls to administrator on call, and to individual Incident Command leaders. Issues can be shared with others who are content experts or in need-to-know roles by simply tagging them as a team member or using the share function as an email. Additionally, labels added to an issue promotes the discovery of trends or the scope of a problem across multiple hospitals within a hospital system. Finally, you can use the Aims page to create measures that may be particularly important to Incident Command, such as how many staff have been tested, left without being seen, or other key pieces of data relative to the pandemic that need to have attention at the highest level of the organization. These are critical and challenging times for healthcare systems and their leaders. We hope that the Incident Management Lens Board is a tool to help the leadership work more efficiently to support patient care.